All right, and we're gonna start the video. And this is my client, Miss Victoria Davis. There is a glare on here. I'm not gonna pay too much attention to it. Anyway, Miss Davis, thank you for coming to see me.
You're welcome. How are you?
All right, I'm Dr. Harris. I am under a licensed professional counselor. I work here at South University as a student under the clinical mental health counseling program. I am required in the beginning to get this consent form signed for the purpose of our session. All right, I'm going to do an interview with you, and I'm going to actually start off by getting you to sign this. Before I get you to sign it, I'm going to go over the confidentiality. So, as a student, I cannot give you any type of legal advice. But rest assured, all of your information, within this interview, it will be confidential unless you give me permission to share it with somebody else. I am also required to tell you that my licensed professional, professor and supervisor, she will be viewing this video. Additionally, if you are a serious threat to yourself or anybody else, kids or disabled, I am required to turn you in. If you are acting of any treason against the United States or have any court subpoenas, I have to inform you as well. Any information can be used against you. All right. As far as audio and videotaping, of course, you see the camera, ahead of you. You can elect not to be videotaped, and it would just be me on camera. But the recording, all information will still go as follows. Everything still can be used. If you actually tell me something illegal, so we do have boundaries of competence. Do you consider yourself competent and the knowledge that I just given you about the consent form?
Yes, I do.
Okay. And the purpose of this session. You take a smile off your face. The purpose of this. Please, Jesus, I can't keep stuck. I'm not starting this camera over again. I'm not starting over. Anyway, so the purpose, oh Lordy, the purpose of this video is to do practice sessions, so I can develop my counseling skills and techniques. All right, so on camera we have the consent form. All righty, and I will have you sign at the top. And while you are doing that, I will turn.
Was it 129?
Yes. Alrighty then, and then I will sign the bottom. Alrighty then. Right, and let's begin. I'm going to ask you a series of questions. The first one is a psychosocial assessment. I'm just going to start with your first and last name, which is Victoria Davis. Am I correct?
That's correct.
All right, and can you provide me with an address, please?
3705 Stanley Drive. It's in Chesapeake, Virginia.
All right, and what is the zip code?
23323. 23. 323. Yeah. That is my zip code.
And your phone number?
757 343 4794.
And your birthday is?
2682.
All right. And what would you consider your ethnicity?
African.
Excuse me?
African.
Okay, thank you so much. So what country are you from? If you don't mind me
Liberia.
asking.
West Africa, Liberia.
Okay, got you. And your primary language?
English, but that is Bassa. Bassa. Bassa.
Is that your primary language or is English your primary?
English is my primary language because we're under English common.
All right. And your marital status, ma'am?
Single, but not too long. Not too long.
All right. And an emergency contact if we need to contact somebody.
You can put my cousin down.
I'm sorry, I couldn't understand you. What was it?
You can put one family member down that I have.
And
You want her name or number first? Which one?
I heard her name would be nice. Thank you.
SAIDEA. Sadia.
All right. And her last name?
Kromah. KROMAH.
All righty. And a phone number if you have it on hand.
757 506 1712.
All right. Do you have any children?
Yes, I have 2 children. I have 2 daughters.
And what are their names?
My oldest daughter name is Destiny.
And the last name?
Boone, Boone.
Okay.
And my youngest daughter is Tori, Tauri.
All
And her
right.
last name is McClary. And CCLA.
Oh, okay. And how old are they again?
My oldest one is 17. She will be 18 in April. And the baby is 9 years old.
Alrighty. And can I get their dates of birth?
The oldest is April 25th, 2002. The youngest one is June the 20th of 2010.
And do both daughters live with you?
Yes.
All right. Is there anybody else who lives in the household? Maybe a father, the kids, anybody?
No, it's just me and my daughters.
Alrighty. All right. And the kids' primary language is English.
It's English as well, yeah.
All right. All right. So the next section will be the next session.
That's you. You don't keep this part of messed up. You gotta start that video over.
Please stop. Excuse me. I apologize, you all. And see, y'all can see me. Oh, and the next section would be the family history. So I will be asking you a series of questions just to get a better understanding of, different mental illnesses, if any, in your family. Alrighty. So I'm going to start with alcohol abuse. Mother, father, siblings, aunts, uncles, or grandparents. Do you know of any history?
Yeah, my uncle was a very heavy abuser. He actually died from it.
Oh wow. Okay. Do you have a history of any completed suicides? Any successful suicides? No suicides. All right. Is there a history of any mental illnesses or problems such as depression,
Depression is one of them.
With which family member? Mother, father, siblings, aunt, uncle, or grandparents?
Uncle.
So depression. All right. Schizophrenia,
No, not at
bipolar disorder,
all. Mm-mm. No.
Alzheimer's.
My grandmother had Alzheimer's.
All righty. Anxiety.
Yes.
With this is just for family members at this point. Is it you or somebody in your family?
Oh, I was saying for family members, the anxiety.
Okay. So which family member?
My aunt.
All right. ADHD, which is attention deficit hyperactivity disorder.
No,
No.
ma'am.
Any learning disorders.
No, Dr. Harris.
School behavior problems.
No.
Incarceration.
No.
Anything else that you may want to add to that?
Nothing. Not at this time, at least.
Alrighty then. Okay, the next section will be a critical population. So this is just to get a better understanding of certain things, factors that may contribute to maybe why you're here, and they may not contribute, but just to give a better understanding, just for assessment purposes. So your funding source, are you on any type of government assistance, SSI, food stamps, TANF, Medicaid, general?
My children receive Medicaid.
Okay. All right. And your residential situation, homeless shelter, long-term care, any of the above? Alrighty. You have any disabilities, physical, severe developmental, chronic, or regional behavior health? All right. Any legal involvement? Any issues with CPS or court or probation, parole, early release, or anything like that?
No, not at all.
Are you under mandatory monitoring?
No.
Are you currently pregnant?
No.
Okay. Gotcha. Okay, the next section would be physical functioning. Do you have any known allergies?
No, I don't.
All right. And you have any current medical issues?
I don't.
Are you on any current medications? And that includes vitamins, herbs, or anything over the counter?
No. I'm not taking anything at this time. Not right now.
Have you ever been on any past medications?
In the past or just anything?
Anything in the past?
I was on Dilantin. Seizure medicine.
Can you spell that for me?
Dilant.
Okay, and do you remember those dates? If you don't, that's okay. But
The time I was on the medicine?
Yes.
My doctor prescribed it in 2003. I stopped taking the medication in 2004. So it was in.
The months or.
The months I'm not accurate on the.
So just 2003.
Yeah.
Okay, gotcha. Have you had any surgeries?
Yes, I had surgery in my left shoulder.
Alrighty. The next section would be a pain questionnaire. So pain management. Are you in pain right now?
No, not in anything.
All right. Are you receiving any care for pain?
No.
This is about your nutrition. So, how's your appetite?
I don't know. I eat a lot.
So you have a good
I
appetite.
have a good appetite.
Okay. Okay, well, let me go back for a second. Do you know your current weight?
167.
Oh, wow. Do you know your current height, ma'am?
5'5".
Okay. Do you know your body mass index?
No, I don't. But I can figure out and I'll provide it to you. But I don't.
Oh, no, that's fine. Thank you so much. Okay. Going back. All right. Have you had any recent loss or gain of any weight significantly?
No, other than 5 pounds here and there, nothing significant, nothing over that.
Okay.
Hmm.
Do you ever have times where you actually restrict food or vomit or?
No, I love food too much. I eat all the time. There's no restriction.
All right. Okay, the next section would be your social network. Do you socialize with immediate family?
On social media?
Well, I mean, if it's on a
Yes.
regular basis, I mean, that could be considered, I guess, a yes.
I mean, yeah, you can say yes. I have family that I talk to, particular ones that I talk to every day. I socialize. You can say that.
And how would you rate that? Are you okay, ma'am? I mean, I'm just noticing that your face is kind of bunched up and, you're shaking. Are you uncomfortable?
I'm not uncomfortable.
Would you
okay.
like me to give you a moment, take a break a little?
No.
Maybe about 2 or 3 minutes together.
Unless you need a break. You need a break. If you need a break, we can break. But I'm just shaking is a habit for me. That's how I'm eating.
Okay. Thank you so much for that information. So on a scale of 1 to 5, how close is your relationship with your immediate family, Miss Davis?
I would say maybe about 4, because the ones that I actually do talk to are the important ones to me. So I would say 4, but other people is just very distant. But.
Okay, gotcha. And you have any friends?
Yeah, I only count on one hand. I got 2 good friends. The other are just associates.
Okay, and what is your relationship on a scale of 1 to 5?
With my friends?
Yes.
5.
Okay, so you have a good support system. All right. And what about your work environment? Are you close with the people that you work with?
I wouldn't say close, but they're good associates. People.
On a scale of 1 to 5, I apologize.
I say about 3.
Oh, that's pretty good.
Yeah, I go there. We work together, and
And what about your religious or spiritual network, if you have any at all?
I'm a Christian woman. I go to church. Not every Sunday, but every Sunday if I'm home, it's because I'm tired or I'm sick. But if you're gonna rate that, I would say it's a 5, because I'm telling y'all right now, I need that.
Okay. Do you have any extended family that you feel like you're close with? Step cousins, step brothers?
No.
Okay. Are you in school?
Yes, I am.
Are you close with anybody at school?
No.
Okay.
Not really. Not at all.
All right. Is there another community that you may be involved with, that you may have maybe some close networks with?
I mean,
any associations?
No, I don't. We have this this group here in Hampton Roads. It's called the Liberian Association Group. But other than that, that's the only other, group that I take part in. We have meeting and discuss each other's needs and stuff like that.
Okay, so how would you rate that on a scale of 1 to 5?
Because I'm a student and I'm busy with work, I don't attend all of the meeting, but I have information to put on social media. So my participation in, I would say, is about a good 2 to 3. It's not as close.
So
as
is
I
it
want.
leaning more toward 2 or is it leaning more towards 3?
Just, I would say 3. I would say 3. Yeah. Yes.
Alrighty. And your living situation, going back to that, is your housing adequate? Is it in?
Yes.
Okay, great. Is there any overcrowding in the house?
No.
Do you consider it safe or dangerous?
No, it's a safe environment to be in.
Okay. Do you have anybody who's a ward of the state, adult or child? Okay. Is there any? Are you at risk of homelessness?
Honestly, no.
Okay. All right. So this section will be the employment section. And again, let me know if you need to take a break. Okay. I know this could be a very long process. All righty. Are you currently employed, Miss Davis?
Yes, I'm employed.
Okay. Are you satisfied with your employment?
The pay can be better, but for the most part, I have a passion for the job that I do, so I'm okay.
Are you satisfied? Is that a yes or no for the satisfaction?
Overall, yes, because I enjoy what I do.
Okay. Do you have any supervisor or coworker conflicts?
No, I don't. Not at all.
That's good. Okay, so the next section would be your financial situation. Do you have any current issues financially? Large debts or anything?
I mean, other than the average person trying to just work on your credits and, medical stuff and stuff, but other than that, no, nothing really.
So no financial difficulty?
No financial difficulty. That is not over, no.
You have any relationships that have ended or been in conflict over finances?
No.
Okay.
No, ma'am.
All right. And your source of income, is this full-time, part-time?
This
seasonal?
is a full-time job.
Gotcha. All righty. Do you receive any other pay? SSI, SSD, retirement, disability,
No.
workman's comp?
No.
Okay. Have you ever been enlisted in the armed forces, any branch of the military?
Not at all.
Okay. And what do you consider this? This is the sexual orientation, so I don't mean to offend you when I ask you this. What is your sexual orientation? Is it heterosexual, homosexual, bisexual, transgender, or other?
My preference?
What are you, ma'am?
I don't know.
What do you identify as?
I am a female.
What do you identify? Do you like men? Do you like women?
Oh my God. For Christ's sake. I like men and only men.
So you are heterosexual.
Okay, and they almost the same. What type of questions are these?
All right. This next section would be your family social history. Can you describe any relationships or desired environment that you want to have in this treatment process? You want to invite anybody into the session once we start?
No, nobody. These are just my own issues.
Okay. All right. So I'm gonna kind of be moving along, just to go just a little bit faster. So if you want me to speed up or slow down,
No, your pace is fine.
Okay.
This is fine with me.
So your legal status, current or past legal problems. Do you have any? You have a gang affiliation? Any convictions, probations, DUIs, arrests of any kind?
No,
All
I
right.
will not stay out of the eyes of the law.
Okay. And what do you consider your highest level of degree?
Associates. Yes, put that. Associate degree.
Alrighty, so some school. And when is your estimated graduation time?
2021 of August.
All right. All right, this is going to be the leisure and recreation part of your life. So, as I call them out, you can say, either yes or no. Okay, all that apply. Spend time with friends.
Yes.
All right. Classes.
Yes.
Time with family.
Yes.
Work part time.
Yes.
Do you go downtown?
Hmm.
I don't know what that means. I do apologize about that one.
I would say no.
Listen to music.
Yes, a lot.
Go to casinos.
No, too broke for that.
Sporting or exercise events.
Yes.
Dancing.
No.
You have any hobbies?
No.
All right. Do you watch TV and movies?
Yes.
Do you stay at home quite often?
Yes, I'm a homebody.
Do you do clubs and bars?
No.
All right. Do you have any other leisure activity that you would like for me to know about?
No, nothing else.
Okay. Are you able to care for yourself without any assistance?
Yes, I'm able to.
All right. All right. So this is going to be any assistive or adaptive devices that you may need or use. If none apply, you can just say no. If any apply, you can say yes. All right. I'm going to go down the list. Hearing aids.
No.
Translator.
No.
Glasses.
Yes.
A cane.
No.
A walker.
No.
Crutches.
No.
Braille.
No.
A wheelchair.
No.
Okay.
No, Dr. Harris. No.
All right, and this section is your psychological mental state of mind. You have any history of depressed mood?
Yes.
All right. Any history of irritability, anger, or violence?
No.
How's your sleep patterns?
It's often no.
So too little, too much.
I would say too little. I don't sleep as much as required. Let's just put it like that.
Can you speak up, please? I'm sorry, I'm not able to hear you as clearly.
Okay, I will speak up for you. Your next question.
How's your ability to concentrate? Is it normal or you have difficulty concentrating?
When I'm in a depressive state of mind, it's very difficult to concentrate for me.
And your energy level, is it normal, high, low, fluctuate? How is it?
I would say it fluctuates because sometimes I can have a high level of energy and just go, and then I just crash. So I would say it fluctuate. Let's go fluctuate. If you have that, that's an option. This nigga.
All right. So, do you have any current symptoms of PTSD?
Yes.
So you do know what that is. Post-traumatic stress disorder.
Post-traumatic stress disorder.
Okay. I'm gonna go down the list, and again, you can say yes or no to those that apply. So, intrusive memories, thoughts, and perceptions. I can't hear you, ma'am. I'm sorry.
No. Excuse me, Dr. Harris.
Avoiding thoughts, feelings, or conversations.
I would say yes.
Avoiding people, places, or activities.
Absolutely, yes.
Hypervigilance.
No.
Nightmares.
Yes.
Detachment from others.
No, I have no problem doing that.
Poor sleep.
Yes. Poor sleep.
Flashbacks.
A lot.
Any restricted display of emotions, meaning you try to keep it in, keep it bottled up.
Yeah, that's just
Irritability.
yes, very often.
Are you irritable right now?
Ah, no, not yet. Not for you. You seem like a very pleasant person.
Oh, well,
I'm
thank
not
you. I
irritated.
appreciate that.
Yes.
Yes. Okay. Have you gone through any bereavement or loss or any type of spiritual enlightenment, as of recent?
No, nothing recent.
All right. This is the next section is going to be about your spiritual and cultural awareness and even practice. So, you're knowledgeable about traditions, spirituality, and religion.
Yes.
All right. Do you practice any spirituality, tradition, or religions?
Yes.
And you said it was
What, my religion?
yes.
Christianity.
I can't hear you, man.
Christianity. I'm a Christian woman. Yeah. I ain't done that. I should have got some water on my throat.
Would you like some water?
Yeah.
Oh, Lord.
Yeah, later I will get some water. We are both coughing very bad.
How would you describe your spirituality?
Like, what does this religion that I practice, what do we practice? Or, like, what are the things that I do within this?
No, meaning, what do you feel about it?
I feel very confident about it. I feel, enthused about it because I know I get the results that I need and the results that I desire. Is a good practice that I'm under, I would say.
All right. Do you see a traditional healer or anything on those lines? Voodoo, perhaps?
No. It's highly practiced in my country, but no. Because of Christianity, you can partake in that.
Okay, and this part is going to talk about any neglect or abuse or exploitation. Do you have any history of emotional, nutritional, medical, educational exploitation or abuse or neglect?
No, I wouldn't say it's neglect. No.
And you say you're from what country again?
Liberia. West Africa.
Okay. Alrighty. Have you ever been abused at any time, past or present, by a family member, significant other, or anyone else?
No.
All right. So I'm going to call out a list of things, and you can tell me if it does or does not apply, and I will ask you by who, if anything does apply. Any verbal put downs?
Yeah, a lot of it.
By who?
Some from family, some from past relationships. As far as, intimate, boyfriend and girlfriend relationships, stuff like that.
All right. Being threatened.
That's always.
By whom?
Random people.
Can you be a little more specific about that?
Example can be like if I'm driving, somebody just intentionally cut me off, do stupid stuff. That's a threat to my life. No.
I'm not so
You talking about
sure.
verbal threatening?
I think that's more of a cultural norm. That's called road rage.
Oh, that's normal here for you guys? Oh, okay.
Yes, ma'am. That's called road rage.
Okay.
It happens very often. So,
the answer would be no. Nobody is threatening me.
Okay. All right. Made to feel afraid or intimidated. Something wrong with your eyes.
My eyes was actually stolen last night, so they're a little irritated.
Did you say stolen?
swollen with an S. SW. Swollen.
Okay, you
My
just have a
accent.
strong. I'm sorry, you just have a strong
Not stolen.
accent. Okay.
Yeah, it was my right one was stolen last night, so it's a little irritated.
Okay. And again, made to feel afraid.
No. Mm-mm.
You ever been pushed or shoved?
Yes,
By whom?
an old ex boyfriend of mine.
Alrighty. Have you ever been slapped, kicked, strangled, hit?
Yes.
By whom, please? To which ones? Slapped. Let's just start with
I've
slapped.
been slapped. I've been kicked.
Strangled or hit?
I've been hit. Never been strangled, but I've been hit before. Push and kick.
And all of these have been by
Just the old ex.
the ex. Okay. Alrighty. And have you ever been forced or coerced into sexual activity or possible rape?
Oh God. No.
Alrighty. Have you ever witnessed any abuse in your family? Any family violence?
No. I mean, other than just the norm, arguing, fighting among each other, siblings and stuff.
Well, I'm more talking about
More
physical.
like no.
Okay. Alrighty. So this next section will be your behavioral assessment. And I'm going to call out a list of things. And you could tell me the age, the frequency. Please stop.
Excuse me, Dr. Iris. I'm sorry.
Are you okay over there?
Yeah, I will get water later.
Okay, get it together. Alrighty. Any alcohol usage?
No.
Cannabis, which is weed.
No.
Cocaine.
No.
Crystal meth, any amphetamines.
No, I don't.
Molly.
No.
Methamphetamine.
Not at all.
Gas, paint, or glue.
No. What is it? Why do people inhale that?
LSD, PCP, mushrooms.
Mushroom? No, I'm serious. Mushroom that you eat, people do it for drugs.
Please forgive me.
No, not at all. I don't even understand these things. No, Dr. Iris.
Any opioids, such as heroin, methadone, or anything.
No, doctor.
Sedatives, such as Valium.
Not at all.
Any steroids, cough syrup usage.
No.
Tobacco.
No.
Caffeine.
No.
Have you ever injected any drugs?
No.
Alrighty. Have you ever traded sex for drugs?
No, not at all.
Have you ever been tested for HIV?
Have I been tested for it? Yeah, I do an annual test for it.
When was the last test?
My last test was last year. I got another one coming up.
And what were the results, if you don't mind?
They were negative. I'm so happy to say that. That's a good one. Ooh. Yes. Negative.
Okay, and I'm going to ask you a series of questions, and you can say yes or no. Have you had any hangovers?
In my whole lifetime?
I would just say recently.
No, because I don't drink.
Overdoses,
No, madam.
sleep problems,
I have difficulty sleeping after long shifts, which is very weird. I have to like wind myself down to sleep. So yeah, some difficulty sleeping.
lost a job,
No,
incarceration,
no,
the shakes,
no,
increased tolerance, needing more to get high,
no.
seizures,
Pass, pass.
DUIs,
No,
homicides,
no,
blackouts,
no,
GI bleeding,
no.
relationship problems.
With whom? Family.
Anybody, family, friend, church, work,
Yes.
personal,
Yes, I had some.
assaults,
Me being assaulted?
or
Yeah.
assaulting anybody else,
No. No, my dear. No, that.
binges,
No,
liver disease,
no,
arrest,
no,
left school.
no.
Okay. All right, and then I'm going to call out another series of things, and you can say yes or no to those that apply. God damn it. Oh, hold on. Excuse me. This shit on the other side.
I'm getting sleepy. Me too.
All right, look at it.
It's back. It's clear.
And I am back. We had a little malfunction. I do apologize. Did it stop? Okay, got it. All right. I'm gonna call out a list of things. Excuse me, ma'am. I'm sorry. Am I bothering you? Okay. Gamble longer than planned.
No, never again.
Lost sleep thinking about gambling.
No,
Borrowed money to gamble.
no,
Remorseful about gambling.
no,
Gambled until your last dollar was gone.
no,
Used income savings to gamble and let bills go unpaid.
no,
Made repeated unsuccessful attempts to stop gambling.
no,
Broken the law or considered breaking the law to gamble.
no,
Gamble to get money to meet financial obligations.
no,
Okay. This is going to be about your risk-taking, impulsive behavior. Have you ever had unprotected sex or currently have any unprotected sex?
yes, I have.
Gang involvement,
No,
shoplifted,
no,
drug dealing,
no,
reckless driving,
no,
carrying or using a weapon
no,
of any kind.
no.
Alright. Okay, I'm gonna go just a little bit faster. These are very simple, not too invasive. It's just going to be a small mental exam. How do you can describe your appearance? I'm gonna either say well groomed or unkempt, disheveled. How do you consider your appearance?
Well grown.
How do you consider your build? Average, thin, overweight, obese?
Average.
How do you feel like your demeanor is? Cooperative, hostile, guarded, withdrawn?
Very cooperative.
And I do apologize. Oh, there.
Yes, Dr. Harris.
I think this is for me to fill out.
Oh, that's okay.
This is for me.
Alright.
then we will have another form of questions that I will be asking you. So just bear with me, and I do
No, you're doing
apologize.
fine. You're doing fine. It's no problem.
All right. So your visit for me today. What's the reason for your visit?
I needed somebody to talk to about some things.
Okay. Could you describe it a little bit more?
As we had explained in the past, sometimes I deal with depression and PTSD, so it was according to my knowledge, the depression part of me was like getting out of hand a little bit, and I just needed to reevaluate myself, sit down and talk to somebody, and try to stay on track and stuff like that.
Okay. So depression. All right. So would you consider it mild, moderate, or severe?
At this point, it's moderate. I'm here because I don't want it to get severe. If that makes sense.
Yes, it does.
Yeah, it's just it have gotten severe, but I'm at a moderate stage right now, so I'm just trying to maintain it.
Okay. Irritability. Do you consider it mild, moderate, or severe?
I would say severe. I get irritated very fast. But
Okay. Mood swings. Mild, moderate, or severe?
nah, that's very mild. I don't.